Hello and welcome back to 90 Seconds Healthcare. The goal of my very brief video today is discussing very briefly what is recommended as goals with our LDL cholesterol, or the bad lipids we call them. So cholesterol check, beat the bad lipids. There is many time confusion of, how low should LDL be? Why should I be lower than my other friends or family members? So I'll very briefly address this topic. Again, high cholesterol or LDL is a definite risk factor, causing clotting and narrowing of the arteries of the heart and the brain and the lower extremity, and causing significant morbidity, illness, and mortality, death. It's extremely important to understand that it is not always needed for the blood vessel to gradually narrow from 10% to 20 to 50 to 70 to 90 to 99 and then have a clot. Many times the narrowing can be minimal or can be moderate and still lead to a massive heart attack or to a stroke. So we really need to discuss this from a cardiovascular prevention standpoint rather than simple lumen size. There's no question that when there's quite a bit of lipid in the blood vessel, the blood vessels are more likely to have clots due to red blood cells and platelets. Again, lipid is only one of many risk factors, including aging, being older, gender, more in men, family history of heart disease, definitely the wrong diet, the elevated blood pressure, the diabetes, the obesity, the physical inactivity, and smoking. I reinforce again and again that a heart attack can occur at any time, even if the narrowing is not very severe, hence the importance of prevention. This is the key slide before I end this very brief presentation. This is from the European Society of Cardiology, the guidelines, and the message is very clear. 5 messages from this slide that I want to give you for your own education and for health literacy. Number 1, that these are guidelines and they are highly recommended and very scientific, reinforcing that elevated lipids in LDL is not a hypothesis as a cause of heart attack and heart disease. It is actually a definite proven fact that elevated LDL is a major risk factor for heart disease and vascular disease. Message number 2, that the units here that you would see are either millimole per liter or milligram per deciliter. Whichever units we use would be fine. Message number 3, if you look to the left side, if you look at this video to the left side, you will see different numbers. So you will see 3 or 116 milligram per deciliter, 2.6 or 100, 1.8 or 70, 1.4 or 55 milligram per deciliter. And very briefly, the message here is there is no one size fits all. Depending on the risk profile of the patient, we are mandated to lower the LDL more and more. 4, if someone is a low risk, even if they are very low risk, based on the history and the risk profile, we call it score, we should never accept an LDL or low density lipoprotein higher than 3 millimole per liter or 116 milligram per deciliter. Any person who has diabetes or kidney disease, it should be lower. And you can see on the right side many of the other cases that I don't have time to discuss now. I'm just giving you a brief idea. 5, any person who's had a heart attack or had a CT coronary angiogram that shows significant amount of calcium, or that they have narrowing, or they had a cath, or they had any test that showed that they have vascular disease anywhere, especially in the heart, we need to go down very low to 1.4 millimole per liter or 55 milligram per deciliter. So it is extremely important to know that the LDL is a major risk factor, that we need to lower our LDL based on our risk profile, and adherence and compliance are key. The right diet, the right exercise, the right weight, the right lifestyle, and taking medications on time consistently and being followed by your cardiologist or primary care physician, ideally every 4 to 6 weeks, till you get to the risk profile that you need or want based on the LDL, and then you can be followed less frequently. This is a very important slide that I show on many occasions, either to my colleagues, healthcare providers, or to the public or to the patients. This is from a Chinese medical text. Imagine how many years ago, years and years ago, 2600 BC, inferior doctors treat the full-blown disease. Can you imagine? Just a reinforcement that prevention was, is, and will always be the focus of humanity, not only in healthcare, but with many other things. Mediocre doctors treat the disease before it's evident, and superior doctors prevent the disease. And I would say superior human beings are engaged, they check themselves, they take good care of themselves, and they prevent the disease. With you was Dr. Samer Ellahham. We can be in contact should you need that, but please hit the like button if you like what we are publishing and showing you. Please remember the idea is not to go in details, but to highlight key concepts and key issues that hopefully will help in prevention. Prevention is our focus. Thank you.